Hello, I'm Mabel Jong. This is a Valid Points executive interview powered by Validation Institute. Validation Institute, a network of health benefits purchasers, advisors, and solution providers focused on delivering better health savings and outcomes and accelerating the move toward high performance and high value healthcare, expertly validating performance claims of healthcare solutions. Validation Institute awarded an outcomes validation and food med certification to digital food pharmacy and meal kit service Season Health. I spoke with Josh Hicks, CEO of Season Health, about the certification and prescribing food as medicine. He's also known as the co-founder of the meal kit service Plated. Thank you so much for being here.
Thank you for having me.
How did the experience running Plated inform what you're doing at Season Health, pairing personalized meal plans with clinical care?
One of the areas of Season that is very directly informed from the experience at Plated was you just can't do population health if you are a food retailer or food manufacturer. There really is no one brand, not any of the big retailers, not any specific food brand that appeals to everybody. Think of whatever is your favorite, and I promise that it doesn't appeal to somebody in your house, somebody in your neighborhood, somebody in your city. And even for the big retailers, most people are shopping elsewhere. And so the big, kind of aha was, well, if you want to work with a health plan who does population health by definition, you really need to partner with a very, very broad range of food brands, food companies, and formats. Sometimes we all want grocery and to cook. Even if you don't cook much, you want groceries in your house. Mm-hmm. Sometimes you want to have prepared meals. Sometimes you want to order, ready to eat, i.e. restaurant and hot food. And you really need to kind of cover all of those use cases to best impact health.
So how does the platform work? Are you assisting health experts to prescribe evidence-based meal plans to manage certain conditions? And what's the technology? How convenient is it to make consumers follow through and sustain a lifestyle change?
What we do is help the dietitian do the part they know best, which is nutrition. They're going to see a patient and evaluate. They're going to have a medical encounter. They're going to, evaluate that person has chronic kidney disease or diabetes or whatever the condition may be. And along with all of their other health factors, build a nutrition plan for them. Mm-hmm. That's put into the back end of the software. And then for the patient, we just let them be a consumer. So it's all, technology based. It can be in an app, it can be in the browser, on the phone, or the computer. It can also be purely telephonic for, members that are offline for various reasons. And the point is we plug into a very broad range of food partners, Walmart and Instacart and Daily Harvest and Territory and Mom's Meals and, on and on and on and on, so that what we're doing is applying the filtering based on both your nutritional profile and your consumer preferences, and leaving you with a very easy to use interface. We're not going to try to switch which grocery store you go to. We're not going to try to switch which restaurants you like or anything else. We're just going to make it impossible for you to do something that you shouldn't be doing at those brands that you already like.
Like such as?
Eating too much potassium if you have CKD.
Okay.
Right.
Okay.
Telling somebody who's already very busy and very sick that they need to manage something like that is horribly stress inducing.
Yeah. But are you seeing that consumers are responding to that tap on the shoulder saying, listen, don't eat that?
100%. We've published some outcomes and have a lot that are coming up. We're seeing, 90+% completion rates of our structured programs. We're seeing what we think are very, very exciting clinical outcomes. So measurably reducing average A1Cs, average BMIs, measurably improving people's health outcomes, and having, and seeing engagement rates, completion rates that are very, very high. So I think that the clear answer is yes.
Well, first of all, what's very exciting about it is not only are they FoodMed certified, but they are certified on the Validation Institute side for healthcare as well.
Benny DeCecca is the CEO of Validation Institute.
But with regards to their FoodMed certification, that really shows that in this area, which we're calling the Wild West of people making actual ridiculous claims on how they can use a food program to change a health outcome, Season Health actually really came to the table with great data and showed us how they're helping people with diabetes. And so this is one of the areas that we as a company, Validation Institute, are really focused on, finding those great food programs that are out there that are delivering great outcomes for different chronic conditions.
Great. Now, although people seem to have a greater understanding of food as medicine, healthcare providers, consumers, they all seem to get it. But what are the challenges, Benny, to implementing food as medicine for the millions of people who should follow this recipe for health?
There are many challenges, and it's a multifaceted issue. First, accessibility and affordability of nutritious, non-ultra processed foods poses a significant barrier, especially for marginalized communities with economic constraints. Secondly, the lack of widespread good education and awareness about the link between diet and health outcomes. Additionally, the complexities of individual dietary needs and variations in health conditions makes a one-size-fits-all approach difficult. So that requires personalized guidance and support. Lastly, cultural and societal norms around food choices and eating habits may conflict with recommended dietary changes. But the good news is we are seeing so many programs that are getting started that are helping address these issues, but we need to get to a place where we see food as medicine as being preventative and not implemented solely when a medical issue is diagnosed.
We can help change what's around you, help change your environment. You will eat better, you will get healthier, and not in a way that is hard and requires this feeling of sacrifice and constant thought and everything else. It will be much more natural. I think getting certified enables us to demonstrate to the payer market in particular that food as medicine works, and that Season is the leader in food as medicine in the way that we define it, which is really clinical services and food together.
Visit validationinstitute.com to learn more about Season Health and other solutions that are delivering better health savings, outcomes, and more. This has been the Valid Points Executive Interview, powered by Validation Institute. I'm Mabel Zhang.